Well, COVID cases and hospitalizations are rising again in some parts of the country. Dane County remains in the medium category of transmission.
A lot of people are understandably asking, what can we do now to minimize the virus in the summer weeks ahead with everybody traveling and gathering?
UW Health's Chief Quality Officer, Dr. Pothof, is here once again for his weekly visit. Welcome back.
Hi, Dr. Pothof.
Good to see you guys.
So, how are we doing in Dane County?
You know, we're holding steady, and if anything, if you look at Dane County, the state, cases seem to be leveling off. A little too early to say that we're going to go on a downward trend, but at least the trend isn't going up like it was.
So, do we know that for sure? Because so many people are testing at home and not reporting it.
Right, so I think true, those numbers are underrepresentations, but if we have about the same number of people testing at home as we did, you know, a few weeks ago, it would at least be a fair representative sample of what's going on. Right now, we kind of are at that peak, so not unexpected that a lot of us know people right now who have COVID. There's a lot of COVID out there. Thankfully, it's not converting to severe disease at the same rate as it did before, either with the Omicron surge or the Delta surge.
And you hear people have both doses of the shot and both booster shots, and they're still contracting the disease.
Yeah, what we lost with Omicron, really Omicron, a little bit with Delta, was this ability for vaccination or boosters to prevent any symptoms at all. Early on, it was really incredible, like 94% a likelihood of not having any symptoms at all if you came in contact with original COVID-19. Now, when you get vaccinated, that 2 weeks later, when that immunity is at its top level, about 80%, so not bad, but it quickly fades. You know, 3-4 weeks later, maybe you've got 30% chance of no symptoms at all. The good news is, the silver lining there is that you're still really well protected against severe disease. So even though we know people who've been vaccinated, who've been boosted, who come down with COVID, they have COVID symptoms, the likelihood of those people ending up really sick in a hospital is actually pretty low.
Do you think we should be testing more frequently and more proactively? For example, if you know you're going to go to a party and you're going to be indoors with people, should you be testing yourself before and after a gathering like that?
I think if you're really trying to look out for your community or make sure that you're not the person who infects someone who doesn't do that very well if they get severe COVID, that's not a bad idea, especially with the easy availability of home tests, antigen tests, to say, hey, you know, I really want to go to this event. It's indoors. There's going to be a lot of people there, but I don't want to be that person who spreads the disease around. If you're to do an antigen test before you go, that gives you some reassurance that you're not going to be that person who, you know, unexpectedly, maybe you don't have symptoms, is going to take COVID to that party, infect other people who may not do so well.
So I'm at home, and let's say I'm not feeling well, and I take a test and I'm positive. What do I do then?
Yeah, so at that point, irrespective if it's an antigen test or a PCR test, when you're positive and you have symptoms, you likely have COVID. In that situation, you want to then isolate so you don't spread it to other people. So if you can, you pick a room in your house. You try to keep yourself away from other folks in that building or in that house, and then you want to isolate for about 5 days. So stay out of public, things like that. After that, the recommendation is, see if you can turn an antigen test negative. If 5 days into it, you feel completely fine, your fever's gone, and now you're negative on an antigen test, there's still a slight chance you could transmit the disease, but it's pretty low. Those folks, put a mask on for the next 5 days. You can probably get out there.
Should you call your doctor to get the antiviral?
Absolutely. So if you are at high risk for severe COVID, i.e. you're unvaccinated and you have some risk factors, maybe you're obese, you have diabetes, maybe you've got some underlying medical conditions, and it's within those 5 days, if you can get a prescription for Paxlovid, you reduce the chance of having severe disease by about 80%. So definitely we're talking to your doctor to see if you qualify for Paxlovid if you test positive.
If you take an antigen test and you test positive, do you still need to get a PCR test, or you can...
You're good. So with the antigen test, if you're positive, you're positive. Now, in an antigen test, you're negative, but you feel like you have COVID, then you need to get the PCR test. Because sometimes that antigen test early on gives you a false negative.
Have we had any more research into long haulers?
Well, there's some new information coming out from studies that say up to 1 in 5 people may experience long haul symptoms. Now, some of those folks will have more severe symptoms. They may have persistent loss to taste and smell. Some of those people may have more mild symptoms, but they may say, hey, you know what, I'm fatigued. It's been 3 months since I had COVID, and I just don't have all my energy back. That's a little bit worrisome that it could be 1 in 5 people. And the more worrisome thing is we don't know how long that's going to last. Some people have had these things for 2 years. Does this ever go away? Will we figure this out? That's a good area for medical study in the the next couple of years.
Do we know how many times you can get COVID?
No, I don't think we want to be the guinea pig for that either. But with other coronaviruses, reinfection is not uncommon. So I think what we'll see is as the virus mutates and we have different variants, we'll have different levels of susceptibility based on previous infections, immunization status, how often we're getting boosted. But reinfection with COVID, I don't think is something that's going to go away.
And what happens this fall? Do we get another vaccine?
I think so. So I don't want to, I'm not clairvoyant, but I think at the FDA meeting in mid-June, they're going to look at not only those 6-month to 5-year-old vaccines, but I think they're going to look at a national vaccine strategy that looks at those of us who are not over the age of 50, who maybe will be due for a second booster, and hopefully give us some guidance as to what we can look for going into the fall. What do we need as far as COVID vaccinations? When do we get those? Will it be at the same time as flu? Maybe so, and give us some idea of what that's going to look like going into the fall.
But quickly, do you think parents should get their kids boosted now, kids that are eligible, or wait for the fall?
I would say get them boosted now because cases are actually pretty high right now. We can avoid those kids getting sick, being out of their summer activities, having any long haul symptoms. That's not to say that there might not be a booster for them sometime down the road, whether it'll be this fall or a little bit later. Hard to say that, but I'd get them boosted now.
Ever-changing landscape.
Yes.
Jeff, good to see you again. See you next week.
Thanks, Dr. Pothof. Good to see you.